Welcome to RVNA Health's Aging and Falls Prevention webinar. I am pleased to introduce today's presenters.
Are joined by Gigi Weiss and Melissa Woodhouse. Gigi is our Director of Rehabilitative Therapies at RVNA Health. She manages both in-home therapy programs as well as our outpatient therapy at our Rehabilitation and Wellness Center in Ridgefield. She's been with RVNA Health for over 10 years. And with her extensive experience in rehab programs, including working directly on RVNA Health's Otago Fall prevention programs, she's going to help us dive today into the facts behind falls and strategies to help us reduce our risk. Following Gigi, we'll have Melissa Woodhouse, who is our Director of our Stay Well Non-Medical Services. She's been with RVNA Health for 6 years. Melissa oversees our in-home personal caregiving services, as well as our Philips Lifeline Medical Alert Service. And as an occupational therapist, she brings significant experience to the topic of safety in our homes. So she'll also be reviewing some proactive steps that we can make in our own homes to reduce the risk of falls. The agenda today, we're going to again review some of the statistics behind falls and the science of why falls increase as we age. A little information on how to know if you're at risk. And finally, we'll end with strategies to help you prevent and reduce your own risk. And as I mentioned, again, question and answers. And again, just as a reminder, for Q&A, you can feel free to use the chat. We will answer the chat questions at the end, as well as at the end, we'll open up the audio lines if you do have any other questions to add. So with that, I'm going to turn it over to Gigi.
Hi, good morning. Thank you for being with us. So I'm just going to go over some statistics of falls. So this slide's just showing about the 10 most common causes of death among older individuals. And as you can see, the number 7 on this list is unintended injury, which really is in the fall category. So it's really important that we do whatever we can to prevent falls. So that's what we're going to kind of go over here today. Do the next slide. So some statistics and older adult falls every 1 second in the United States. In 2015, more than 1 in 4 older adults were reporting a fall. So this is just a little slide of kind of, where things fall. There was 36 million falls. Out of those 36 million, there were 8 million with injuries. 3 million from those had to go to the ED. 950,000 from the fall had a hospitalization. And then from the fall, 32,000 resulted in death. So it kind of shows about how many falls there are, and then kind of what the results of the fall. So some other statistics: 95% of falls results in hip fractures. There's falls also cause brain injury when you fall and hit your head. There falls also, as a result of the fall, you may end up in some sort of skilled nursing placement ultimately because of the injury. And then again, the fall rates increased about 30%. The death rates as a result of fall increased about 30% from in a 10-year period from 2009 and 2018. And the reason why we think that is because people are living longer and people are falling at an older age. So it seems that the death rate increases as a result of that. Again, as we age, it's very important that we reduce the risks because of that there's more fall risk because of some of the chronic conditions that we have, and also an increased use of prescription medications. and some of the results of that can cause increased falling by 30% or more. And also as we age, our strength goes down, our endurance goes down, our muscle ability to kind of get strong and is reduced, and there's also a reduced reaction time. So it's really important, and we'll discuss some of these things. So for every strength and endurance can be reduced by 10%. You have muscle power can reduce by 30% for every decade that we age after the age of 30. 30 is kind of like we're in our prime. And after that, everything unfortunately starts to slow down and go down. And also increased falling risk. The fear of falling also can increase the falling risk because of your fear for because of the fear of falling. You tend to have less activity, which is very important, and that's why the fall risk goes up. So these are some key factors that can lead to falls, problems with walking, any kind of mobility problem. Postural hypotension, what that is if your blood pressure reduces as you change position. So as you go from laying down to sitting up to standing, your blood pressure can tend to drop. So there are some things you can do to reduce that, sometimes compression stoppings, but that just causes a lightheadedness and then a chance of falling. Another risk is if you are on 4 or more medications, they find that it's an increased risk of falling because of some of the interaction and also what those medications are doing for you. They could be for your hypotension. Anything with 4 or more medications. Visual problems. So if you are having issues with your vision, it's really important to get that checked out. We'll talk about that. But if you have any kind of visual problems, it can lead to falls. Home hazards. This is another thing we'll talk about. And basically that is kind of like your home, making sure that your home is safe. And then unsafe footwear. And we'll talk about that, making sure that you have the proper footwear in order to keep you stable. And then from those risk factors, if you have one of those risk factors, you have an 8% chance of falling. If you have 2, you have a 19% chance. So as the number of risk factors go up, your chance of falling increases. So that's what this slide is showing. So it's really important. So if we can limit some of those risk factors, your chance of falling will decrease. This is a little self-assessment. This is from the CDC, which we've all heard a lot about these days. This is their initiative. It was called their STEADY initiative for falling. And basically it's a self-assessment. You read through these questions. You could go right to the website and get this. And if you have answered 4 or more yeses to any of these questions, it does just give you a little bit of an increased risk of falling. So, and again, some of these things can be changed that we could try to, work out, but this is just a good little kind of self-assessment for you to kind of see where you think you are on the fall risk scale. Okay, so what are we going to do to try to prevent fall? So there are a lot of things we can do. We can take control over, and we can help prevent fall. So first of all, the most important thing is to go to your physician regularly. And then when you're there, you talk to him about this or her about this. So to talk about any falls that you've had, even if it's just a little stumble, and then and then you could talk about some prevention. Really important to review your medications, review when you take those medications and any side effects with those medications. It's really important. Some medications, like blood pressure medications, you want to make sure you're taking that medication at the same time every day. You don't want to take it in the morning one day and then take it at night, or take it at the night and then the next morning, because it's really important to help control your blood pressure. Blood pressure can cause dizziness and falling. So reviewing those medications. Also, when you're at the doctor, discuss, supplements for bone support, if you bone growth, and if you have any diagnosis of osteopenia, which is a precursor to osteoporosis, you want to discuss that, because that's really important. Discuss, your feet are very important. If you're having any kind of foot pain or anything like that, discuss that with the doctor. Also, it's very important to discuss and do have good balanced meals. Make sure you're eating meals, breakfast, lunch, and dinner. Don't, because we all know that you need that energy. So it's really important to have those balanced meals, because it does help avoid the weaknesses that you have, that dizziness, that the blood sugar drops, and all those kind of things. And then, as we talked about, generally going to your eye doctor, making sure if you have any sort of vision issues that you get those eye exams, and then you get prescriptions if needed. So this is what we talk about, a little bit about shoes. Really important to wear good shoes in the home and out of the home. I always say slippers do nothing but make you slip. So it's better to have a kind of like a house shoe that has good soles, good support, and wear that shoe in the house than to wear a slipper. And if you, we all, you want a nice solid, if you insist on having heels, a nice solid chunky wedge is better than one of those little heels. So really important to really look at your shoes, because it has a lot to do with falls. Walking aids. So 2 things with walking aids. If it has been suggested to you that you need a walking aid, it's very important that you use it. It's better to use a walking aid because it returns you your mobility. It's better to use a cane and be independent than to not have that cane and have to rely on somebody or fall. So really important, if it's been suggested to you to use any sort of walking aid, to use it. So this also slide's just telling you to how it's properly fitted. You want to stand up nice and tall, drop your hands at your side, and make sure that wherever it falls, it's kind of right at your wrist. So that's what that is. But the most important thing is if it was suggested to you to use one, it really is important that you use it. Okay, another thing, don't rush. Take your time. So we always find that people are falling when they're rushing to do something, rushing to the bathroom, right? And those kind of things. It's better to get there a little late and maybe have a little accident than it is to rush there and fall. So, or around your house. So just really take your time. We find that people are falling when they're not thinking, and they're rushing to do something. Another important thing, what we talked about with the muscle, the loss of muscle mass, is exercise regularly. So we don't expect everyone to get on the steps, but I just love this little picture. So exercise regularly, and we'll kind of talk about some things. Walking programs. If you are able to walk, I know it's getting colder now, but it's really important that you're able to incorporate walking programs. Even if in your home, you can just do a 10-minute walk and break it up to 3 times a day, that's better than sitting and doing nothing. So ideally 30 minutes twice a week is what they say is kind of the gold standard. But any kind of getting up and walking into short distances. I know, we're getting into colder months. So, what if you can try to figure out some place in your home to just walk. I always say, even, if you have to go to the bathroom, take the long route, do whatever you can. But ideally, if you can get into some sort of walking program, I know it's harder these days, but it's very, very important. I wanted just to go over some simple exercises that you can do in your home that's really works on strength and balance and preventing falls. So this is just a typical sit to stand exercise. It builds leg strength and improves all the body mechanics and balance. So basically, you find a sturdy chair, and if you have a countertop next to you or a table, and you're trying to, you sit down, you scoot yourself to the, closer to the edge of the chair. And this is the best position, is to try not to use your hands, because you want to build strength in your legs, and try to bring yourself up. you can start by pushing yourself off with your hands and then kind of go up, down, you know, and up and down, and repeat that like 10 times. And you want to slowly go down, no plopping into the chairs, but slowly go down. Control that really works on strengthening of the legs and balance as you're standing. So if you stand up, it's always good to have a, and if you don't have a table, if you have a walker, do it with your walker in front of you, and then just practice that 10 times. If you're watching TV, take a break during commercials and do some sit to stands. Keeping those legs and ankles and so strong is so important to prevent falls. Another kind of exercise that you can do is kind of a standing sidestepping. So again, at a countertop, this is great. We usually do this in a kitchen, at the kitchen counter. If you want a chair behind you, it's good to do that. But basically, you're standing in the first picture with your feet, shoulder length apart. Then you take a step towards the center, and then once you get comfortable, you can kind of lift your hands up, from the countertop, and then step back and forth. So you're basically sidestepping. And then the third picture there is just a little bit of a progression of standing, stepping, kind of standing on one leg, but having the tabletop there. That's kind of like a more advanced exercise, but this is just some basic kind of things I just wanted to show you, that's simple for you to do, and at your home. And again, any kind of exercise, repeating 10 times, doing it two times a day ideally, is beneficial. We have many of our therapists are trained in Ontago Balance Program. It's an evidence-based program that actually came out of Ontago, New Zealand, and incorporates flexibility, strength, and balance. And basically, if there's a series of many exercises starting in sitting, then to standing, and then to dynamic standing, which is like walking. By doing these exercises on a regular basis, it has been shown that in community-based people, it reduces the risk of falling by 30%. So I didn't want to go through every exercise, but they're pretty much similar to what I showed you before, but they do start in sitting, and then you progress to standing, and then ultimately walking. And then walking program is the last phase of that Ontario program. So and exercises are done 3 times a week, and then again, exercises can be divided up into 10-minute segments, so that you don't have to do that 1 30-minute. You can try to build yourself up. So it just kind of gives a little overview of that program. Okay. So I'm going to stop for now, and Melissa's going to come on and do her part.
Hi, everyone. I'm Melissa Woodhouse, and as Tricia said, I'm an occupational therapist. Home safety is one of my favorite topics, and truly one of the simplest things you could do to prevent a fall. And I do these things as well at my house, because you can fall at any age. So it's important to really keep these things in mind. For starters, stairs and steps, simple, like I said, keep objects off the stairs, fix any loose or uneven steps. I know, maybe many years you say, oh, this railing's always been loose. Well, now's the time, fix it, because, it can certainly make a difference. Carpets, repair any loose or torn carpets, or use non-slip rubber treads. This is huge. I know people love their carpets, and I'm going to mention it a bunch of times, but really, really, making sure that they're stable and you can't slide on them is very important. Handrails on both sides of the stairs is a great tip, like in this picture. It gives you more balance when you're using both of your arms to support yourself. Lighting is huge also. Maintain overhead lights, or install, there's these great motion sensor lights now that you could buy, that you can even plug into the outlets at the top and the bottom to increase visibility. The most common time to fall is at night, and it's important to keep it bright so that you know where you're going. And as we mentioned, the handrails. Flooring, you want to keep your walking pathways clear. I know it seems simple, but you really want to focus, because you could trip on the simplest thing, whether it's a cord or, you know, something that maybe you put down just temporarily because, you know, like Gigi said, you don't want to rush and then you could trip on something. Again, rugs you want to remove or you want to secure the rugs that you have down. I mean, you could go anywhere, Kohl's, Amazon, and you can buy like non-slip material that you can cut and just put that right underneath your rug. It makes a huge difference. We see people all the time slip on their rugs. So, you know, really that's a simple thing. And like I mentioned, you want to clear or tape any cords or wires. And again, lighting, you're going to hear me say that a lot. Lighting is so important. And you can use the motion sensor lights anywhere in your home, you know, for nighttime. Kitchen, you know, this is the heart of the home. You want to make sure it's safe. Move most items within reach or, you know, to the lower shelves. You can, you know, put your heavy pots on your counters that you use every day so that you don't have to bend down or reach to get them. You know, I think a kitchen looks the nicest when it looks lived in, and you can make it look nice as well and have everything within reach. I love this picture here. You can see all the spices are within reach. It's an important thing. Avoid using a step stool. You know, that's why we want things within reach because step stools are just a huge hazard. So if you can have everything where you can get it, it's more, you know, it's more safe. And then clean up any spills immediately. You know, keep a towel, or I love my Swiffer wet jet. You know, you just throw that cloth on the bottom and you can clean it right up. In the bedroom, again, easy to reach light near the bed. You know, Gigi mentioned postural hypotension, you know, when you're laying and then you're sitting, you know, you might feel a little dizzy at nighttime. If it's dark, you might not realize you're very dizzy. So it's good to sit at the edge of the bed, turn your light on that's near you, give yourself a couple of seconds, and then get up and walk to the bathroom. Clear pathway from the bed to the bathroom as well. You know, laundry baskets with clothes in it, you know, you want to keep that out of your way. Like I said, nighttime is the most common time to fall. So you want to make sure that it's nice and clear and you don't fall anything in the middle of the night. Consider installing a bed rail. This is one of a very common thing that we recommend as OTs. And you can see this woman here has it. It even has like a cute little pocket. You could put your phone or, you know, your remote for the TV. But it's a great device that you can help push off the bed safely from. Very easy to buy. You know, they range from like $50 to $100. You can get them on Amazon or any of the local stores, DME, durable medical equipment stores around. And then also move your phone within arm's reach, you know, of your bed. So again, you don't want to reach, and if you aren't feeling well, you know, you have your phone right there where you can call somebody. Bathrooms, you know, huge area to fall due to the wetness from the shower. You want to use a non-slip mat or strips in the tub or the shower. Really take a look at that. You know, I think, you know, we think, oh, we've been showering all this time without a problem, but really take a look and see, is it slippery? I mean, falling in the shower is probably the most embarrassing place to fall, and you really want to make sure, and dangerous too. You want to make sure that it's safe. Install grab bars by the toilet and the tub. They have millions of grab bars that you can purchase that are pretty and, you know, they look nice with your bathroom and you know, match. So I think that that's a huge help. They also have ones that that you can suction cup on that are great as well. You know, consider the height of the toilet. So if it's too low, it's more difficult to get up from. And there's something called a raised toilet seat that you can put on the top of your toilet with grab bars. So it's nice and easy to get up and down from your toilet and much safer. And then lastly, consider a shower chair and a handheld shower head. Handheld shower heads are so helpful especially if you have a shower chair. So you can sit, take the handheld shower head off. You can even leave it hanging in your shower so that you don't have to reach and grab it. You know, of course, you have to make sure that you are directing the water as you're turning on the shower to the right spot so it doesn't get all over the place. But you know, you can sit and shower, use the handheld shower head really easily to get all the places, and sitting in the shower is the safest. So this is a simple thing you could do. So just to sort of summarize, I mean, I can talk about home safety for hours and hours and hours, but just remember, you know, when you are looking at your home, good lighting, reduce the clutter and accessibility. You want to make sure you can get to everything safely. So I just included a couple of, well, more than a couple of pictures here, because there's so many different things that you can do. And I just wanted to give you some other ideas. So in picture A, you want to look at the outside of your house too. How many stairs are there to get in? Do you have the two railings? It's definitely safer to use the two and more helpful. And B, this is another style of grab bar that you can use in your shower. There's just so many different options, which are really helpful and also very pretty. C, this is actually a shower chair for a shower that has a tub insert. So stepping over that tub is very, very tricky. So what you would do in this case is you would sit on the edge of the bench, scoot yourself in, and just raise your legs as you're sitting into the tub, and you can sit for the shower. If this is a great option, if you don't want to put grab bars in your shower. D is a bidet. This is really simple, and actually what they have now is they have like bidet toppers that you can put on your existing toilet, and they have everything from cleaning, drying, and this is really great for people who have a hard time standing for a prolonged period of time. Maybe their balance is really off, and it's difficult for them to reach to do their personal care, and this is a really, really good and simple option. E, if you are doing any sort of home modifications, think about where your plugs are. If ever you had to use a wheelchair in your house, having the plugs accessible is a really helpful thing. So you can see here the plug is lower down within reach. F, this is a bathroom that has a roll-in shower. This is like your perfect option if you want to stay in your home long term and reduce the risk of falling. Like I said, with the tub insert going in and out can be a little tricky. You just walk right in. There's a little bench right there. And then also the toilet there has some grab bars, which I had mentioned before. Lastly, this is a very cool option that actually I believe a physical therapist came up with many years ago. I had heard about it, but it's a portable shower that you can get in your home. So, think about stairs too. Doing stairs can be tricky. And if your balance is off, if you can get everything on the first floor, it's always the safest. So, this is just an option if you don't want to spend tons and tons of money in putting a full shower on your first level. You can have something like this, and this person So, we wanted to mention personal medical alert devices. We have Lifeline here at RVNA Health. Gigi mentioned how to reduce, falls, the risk for fall or just falling in general. But we want to talk about too, like how long, if you do fall, how long you're on the ground. I mean, that actually can play a huge role in your survival rate. The mortality rate from falls has been determined to be 67% when people are on the floor for more than 72 hours. This is just huge. So there's something that can happen when you fall and you're on the floor for a long period of time, rhabdomyolysis. It's a breakdown of muscle and it releases a toxin into your body and it could be deadly. Urinary tract infections, tons of things. If you're laying on the floor for an extended period of time, you don't have access to a bathroom. So 67% of people who are on the floor for more than 72 hours passed away, as opposed to 12% when they were back up within an hour. Of the patients found alive, 62% were hospitalized and approximately half required the intensive care unit. Of the survivors, over 60% were unable to return to independent living, which is really detrimental for many people to not be able to go back to their house. So just consider, having a medical alert system allows you to get help right away and, reduces the amount of time you're on the floor. So, I think without a personal medical alert device, a fall help within 22 to 72 hours is pretty common, but with a medical alert device, you can get help immediately. So we have a bunch of different options of medical alert devices here at RVNA. We have your basic, you have it there. There's actually what I could talk about first is that it's broken down. You can have ones that you can only use in the house, and there's one that you can use like when you're out and about as well. It has a GPS tracker in it. So the first at-home option is the one, simple. You just hit a button. We have the bracelet and the necklace, and then help comes right away. And then we also have one that has an auto alert option, which is very, very nice. If you fall and you're unconscious and you're unable to hit the button, it will actually call 911 immediately for you. And then the on-the-go option is just like it is like it sounds. You can go when you go to the supermarket, or you take a walk, or you go to the library and you fall, you can just hit it, and help will be on its way. So we have a special year-end promotion at RVNA Health. If you sign up for the a Philips Lifeline unit, you get 1 month for free. So this ends at the end of December, and hopefully you'll be interested in it.
Thank you, Melissa and Gigi, for all of your insights. And so what we'd like them to go through any of the questions that have come in on the chat line. And once we're through those, we will open up the audio for anybody else who has any additional questions.
Our first question is for Gigi, and the question is, how long does the Otago program take to complete? And do I need a referral for that program?
The Otago's Fall program, the therapists are all certified. It can be in any setting. So we can start it in the home care setting if you've had a fall and we're trying, and we can work on preventing further falls. We can also see you under a different benefit of your Medicare, which is your outpatient benefit, but we can start it in the home. It typically, and then we can carry it through to outpatient. And then the goal is that you continue it in the community. So after the program. So it typically, ideally, getting a prescription from the doctor. If you've fear of falling, we can get you started. It's typically 3 times. It starts 3 times a week. The intensity starts kind of higher, and then it kind of dwindles and tapers down as it goes through. It's really meant to be like a 6-month program. So the first month is kind of with the hands of the therapist, and then the second month you kind of do more on your own, and then the third month you're kind of doing it all on your own, and then the 4th and 5th month it's kind of like check-ins. So and then hopefully you kind of created that habit of doing the exercises and maintaining that strength and stability and flexibility. And then you kind of continue further on your own. You've developed that walking program and all that. So we can start it in the home, we can transition to outpatient, and then you kind of work on it on your own going forward. So I hope that answers the question a little bit.
Great, Gigi, thank you. I think the next question is for Melissa. The question is, are there services or companies who will implement home safety inspections and improvements for me?
Yeah, so I mean, it's something we offer as a free service if you're getting our other services. So, if you're a client or a patient of RVNA Health, we're happy to go out and do that.
And typically, that's part of our first visit. If we're seeing you in home care, either the nurse or the therapist comes in and does kind of a home safety evaluation, gives you suggestions and any changes. So if you're not part of of our home care, there are ways for us to get out there as well and kind of have a skilled eye giving you some suggestions.
And Gigi or Melissa, just as a follow-up, that if you are not a current patient, I guess, what is that process, or who would you contact if you're interested in following up on home safety improvements or suggestions?
Yeah, our intake department, you can call them, with our main number there, and there's an option if you're a new patient, you can just give them a call and they'll connect you to the right person.
Okay, perfect. And we'll be sure everyone who's attended today, we will email out our contact information, including how to contact the intake department. Melissa, I think another question for you. How expensive is Lifeline?
So it varies from like $30 to $60 a month, depending on what unit you pick.
And we do the installation.
For free. Yep. And as well as free maintenance. So like if you need a battery change, which you will periodically, it's all free of charge, and someone will come out to your home, do the installation like Gigi mentioned, and also the maintenance piece of it.
What's also nice if you're on, our Lifeline, the Lifeline system, if you do have a fall, it helps the transition if you need the home health. Sometimes sometimes we have patients that have Lifeline and they're on our home health system and they've fallen, and now we're notified, so that our therapists are notified. So it allows a whole kind of nice loop, continuation of care. So we're all kind of involved.
Yep. Or even if you're not on the services, it gives us a report, and we can help you and get you the services you need if you do fall.
Okay, great. Melissa, can you also talk a little bit more about the special that's available in December on Lifeline? What exactly does that provide, or how will that work? The
Yeah, so
promotion.
if you give us a call, from now until the end of the month, we'll give you 1 month for free for the year. So you have to call our intake department, 203-438-5555, hit the option for the new patient, and they'll set you up, and we'll provide you a month free after that.
And I think it's also important to know the Lifeline is not just a fall-in thing. It's really a medical alert. So
Right.
if you're having any sort of medical distress and you can't get to your phone, you can press that button and call, not they'll answer, and that's another way to get a hold of 911. So it's not
Right.
just a fallen thing, it's a true medical alert.
Yeah, good point. I mean, we've even had people who, because they're alone, they don't live with anybody else, and they hear something kind of, sort of suspicious outside. They've called the button as well, even for that, and they can send a police officer over to investigate it.
Great. We also had a participant just mention, and maybe you can comment on that having an Apple Watch could provide a good alternative to a personal medical alert device. Do you have any comments to add on that?
Yeah, I mean, if you're tech savvy and you have one, I know some people have used it before. I haven't had any personal experience with it, but it's definitely an option. There's lots of different options out there. I think the Lifeline is nice because there's the fall detection. Like I said, if you fall and you're unconscious, it calls 911 for you immediately if you get that specific device, and it's linked to us, which the other systems don't have. But there are tons of different services you can try out.
Okay, we had one other just chat question, and then I will open it up for audio questions. Will the presentation be available to watch again? And the answer is yes. We've just got to process our recording and figure out a place that we'll host it, but we will be sure to send all of you a link to the presentation information following this session. At that point, what I'm going to do is I am going to, for anybody that is interested in asking a question, if you give me give me 1 second, asking a question via audio, I'm going to all send you guys right now. It will be a little request to unmute yourself. If you would like to ask a question via audio, feel free to go ahead and unmute yourself and ask a question.
Please ask away. We love questions.
All right. Well, hopefully, everyone who's had a question has had a chance to ask. Obviously, again, we are going to be emailing you after this presentation So if you do have, and I'll be sending Melissa and Gigi's information just so you know again who they are within our organization. So if you do have any additional follow-up questions, you can feel free to contact us. And again, we really appreciate everyone for attending today. Hope that this was a useful session. And thank you to Gigi and Melissa for the valuable information and experience that you guys have been able to share with us. Thank you again. I hope everybody has a great day.
You know,
Bye. Thank you.